Hello, everyone. Good afternoon. Welcome to our webinar, Knowing Better, Doing Better, HR Executives' Perspectives on Employee Financial Health. Today, we at the Financial Health Network are so excited to introduce our latest research on employee financial health and host a conversation with several colleagues about what these findings mean for their organization. I'm Beth Brockland. I'm a Senior Director here at the Financial Health Network, and I'm part of the team that leads our efforts with employers and focus on employee financial health. I'm also one of the authors of this report. I'm very pleased to introduce Calvin St-Juste, Executive Director and Chief Operating Officer and Head of Business Strategy for Financial Wellness at Morgan Stanley, and Ryan Eaglehart, Associate Wellbeing Manager at Humana. Ryan and Calvin have joined us today for our conversation about the findings of this study, and will be joining us shortly as we begin the conversation. But I want to thank both of them for joining me today. In terms of an agenda, I'm going to spend just a few minutes walking you all through the findings of our research, introducing the results of our study. And then we'll open it up. We'll bring Ryan and Calvin on screen, and we'll engage in a conversation, including taking questions from all of you. So over the course of my presentation and also the conversation with Ryan and Calvin, please feel free to use the Q&A function at the bottom of your screen to share any questions you have, and we'll be sure to work those into the conversation. So without further ado, I'm going to dive right into the data. This survey is the second in a series of surveys we've conducted here at the Financial Health Network, both of which have been done in partnership with Morgan Stanley at Work. The first was in 2019 when we surveyed 1,000 employees of mid to large size companies about their financial health, about their perceptions of their employer's role in supporting their financial health, and their interest in a wide range of potential benefits and solutions that could be offered through their workplaces to support their financial health. This year, we've turned our lens on employers. We sought to better understand how aware employers are of the financial health challenges of their workers, the actions that they're taking to incorporate financial health into their human resources strategies, and how they're approaching decision-making during this time of crisis and beyond. The survey was fielded earlier this year in July by a partner of ours, Beresford Research, which is a custom market research firm that specializes in executive surveys and interviews. And all of our respondents were VP level or above, with decision-making authority over over benefits in their organization. All of our respondents represent organizations of 500 or more employees, and you can see we had about a 50-50 breakdown, a 50-50 split between employers with more or less than 2,500 employees. And our respondents represented a wide range of industries, as you can see here on the slide. So first, our first key finding. Employers, we found, consider themselves aware of the financial health challenges of their workforce and are taking action to address them. More than half say that they've taken steps to incorporate financial health into their human resources strategy. This is in addition to the 86% who say that they are aware of the challenges of their employees. And we found similar percentages, similar to the 54% who have taken steps to incorporate financial health into their human resources strategy. Similar percentages say that they have taken other actions, such as offering solutions to solve the financial challenges of their employees, or talking about financial health at top HR management meetings. And this is consistent with other recent surveys, including a survey that just came out from the Employee Benefits Research Institute, which have taken a more of a longitudinal view and have shown that increase in financial health, financial wellness of employees has been growing over the last several years. We also found that employers' top motivations for offering financial health benefits to their employees really center around employee well-being and engagement, even more so than narrow budgetary concerns like reducing healthcare costs. And I think that's illustrated very well with this quote on the screen here, on the slide here. In fact, 4 in 10 of our respondents said that they are offering financial health benefits to their workers because it's simply the right thing to do. Second, we found that employers are maintaining or increasing their investment as a result of COVID-19, that COVID-19 is in fact accelerating the trend toward a greater interest and investment in financial health among employers. Overall, as you can see on the first circle to the left on the slide, 85% of employers say that they plan to spend the same or more on financial health benefits over the next 2 years. We also, however, asked employers if they've seen evidence of hardship among their employees. We specifically asked if they've seen an increase in demand for 401k loans or hardship withdrawals, or requests for pay advances since the beginning of the pandemic. Our hypothesis is that these were measures that employers would have readily available metrics that they could see obvious evidence of hardship. And we hypothesize that those that have actually seen evidence of hardship among their workforce, measurable evidence of hardship, would be more likely to say that they plan to invest in financial health benefits over the next several years than those who haven't seen that evidence of hardship. And indeed, that's what we found. You can see in the second and the third circles on this slide that 40% of those who've seen evidence of hardship, as we defined it in the survey, say that they plan to spend more on financial health benefits over the next 2 years, compared to only 16% of those that have not. And similarly, employers that have seen evidence of hardship say that they are much more likely to say that financial health is an important component of their employee engagement strategy post-COVID-19. And third, while it's certainly encouraging that employers are interested in and aware of employees' challenges, we dug a bit deeper and we discovered that that awareness is largely based on limited metrics, which we believe is contributing to a gap between employee needs and solutions. The most common ways that employers are assessing the financial well-being of their workforce is by looking at metrics related to the existing programs that they already offer, such as 401ks and health plans. While assessing metrics based on these benefits is obviously important, they provide a limited view into the the complexity, the complex nature of our financial lives as employees. And so we also found, for example, that a quarter or more of our respondents say that they've looked at any of these metrics that we asked about in the survey only once, or on an ad hoc basis, or even they've never looked. So a significant minority of employers, is not taking a consistent and ongoing approach to understanding and assessing their employees' needs. Furthermore, when we asked whether employers are further disaggregating the data that they have available to them to better understand how needs might differ based on different demographics or types of workers that comprise their workforce, and we found that many of them are not doing this further level of analysis, which is a real missed opportunity given how workers' needs vary based on their demographics and other factors. And as I mentioned, we believe that this is contributing to the gap that we see between employees' needs and solutions that are offered to them via the workplace. The data presented here come from our previous survey, in which we found that fully a third of the employees that we surveyed do not have access to financial health, financial wellness benefits to help them with their financial needs beyond retirement. Looking down the list, you can see that besides retirement, access to any of these other benefits mentioned here is 32% or below. Yet among those that have access, who report having access, when we ask if they've used the benefit, the percentages are much higher. So we think these benefits are, this is evidence that these benefits are quite popular among employees when they have them, that they are meeting needs, but yet that few of them still have access. This is changing, certainly, and we believe that it will continue to change in light of COVID as more and more employers become aware of the needs that employees have, particularly short-term needs around day-to-day spending, paying bills, and saving for emergencies. but we still think there's certainly an opportunity here for employers to embrace a more holistic approach to measuring the financial needs of their workers and using the information they gain from that measurement to meet those needs. And this is one of the reasons why the Financial Health Network has joined with our partners Just Capital, PayPal, and the Good Jobs Institute to launch the Worker Financial Wellness Initiative. Through this initiative, we are calling on CEOs of America's largest companies to conduct a worker financial wellness assessment. This could include looking at wages, benefits, and overall financial health to really understand the needs of your workers. In this moment of unprecedented health and financial and economic crisis, there's a real opportunity for employers and C-suite leaders to step back and to take a look at the financial needs of their workers, understand how they're faring, and to take that into account as they plan for the period going forward post-recovery. We encourage anyone who's interested in learning more about the initiative to visit the link on the slide, which we will also drop into the chat, or to reach out to us to discuss further. And so without further ado, I am going to pause. We're going to take off the screen share, and I'm going to invite Calvin and Ryan back on screen, or on screen for the first time, to join us for the conversation. Hi, Calvin. Hi, Ryan.
Hey, Beth. How are you?
Great. Great to have you both here. Well, let's just dive right in. So, Ryan, I want to begin with you. As I just shared, our survey found that employers are overwhelmingly consider themselves aware of the financial health challenges of their employees. And that this is really something that we've seen in other research as well, that this awareness, this interest in financial health, financial well-being among employers has been growing significantly over the last several years. Why do you think why do you think financial health has become increasingly important to employers, and why is it important to you and your team at Humana?
Yeah, absolutely. You know, I think that it'd be remiss to just talk about financial health as an independent concept. You know, I really look back and think about this as part of the growth of the focus that employers have had on overall well-being. You know, 10 years ago, Humana first named well-being as a strategic objective, both for how we support our associates, but also how we serve our members. And when that was put out there, a lot of people, especially in the employer space, equated well-being with wellness, and wellness was roughly equated to health. And that was even most commonly thought of as physical health. And it's really come a long way in terms of the way that employers are thinking about supporting their employee populations with more holistic perspective. And really that's, you know, the financial health piece has been a key component of that. As we look to really optimize our business and run a very efficient business, you know, human capital is a key component of that, especially in service industries where our associates are really the face of our business with our customers. You know, only through supporting and maximizing our associates are we really able to achieve our business objectives. I think that, you know, one of those things that's really done is made associate concerns and desires, you know, come more to the forefront. And financial health is one of those that has become more and more commonly talked about and shared among associates as an area that they want more support and help in addressing. That you know, has been an area of growing need, and also one that, frankly, certainly from our perspective, more and more people are open to partnering with employers to address.
Thanks, Ryan. I think there's a lot to unpack there. Particularly, I'm interested in your last comment about how employees, associates want the support and are coming to you saying, you know, this is support that we want from our employer. I want to come back to that and talk a little bit more about some of the ways in which you have gathered that input from your workforce to understand what it is that they're looking for. How do you know that they're looking for that kind of support? But before we do, I want to turn to Calvin first and just ask, high level, Calvin, Curious if this resonates from your experience. You know, Morgan Stanley at Work, you work with a wide variety of employers. So I'm curious what you've seen among the employers you work with, among your clients, in terms of the awareness that they have of the financial challenges of their workforce and their willingness to put dollars behind solving some of those challenges for their workers.
Yeah, and that's absolutely a really good question. So, I mean, what we're seeing is really three big challenges. The first, over the past few years, the majority of organizations have prioritized delivering financial education and solutions to their employee population to help those employees continue to thrive, even if another major economic downturn occurs. There's been a big focus on helping employees to become financially resilient. And a key piece of that is achieving this, is to deliver education, advice, and guidance. The second thing we've seen, we begin noticing, is that many organizations who have in the past only focused on delivering education components of their offering, they're looking to expand their scope of devoting a portion of their budget to individual planning and guidance services. I'll give you an example. So recently we had one of our clients in the manufacturing sector that only used our financial education and one-on-one consultation services for their frontline workers. They decided to begin offering financial planning for their mid-level executives. During the pandemic, they began to see their vice presidents and senior vice presidents asking questions around, I need to begin thinking about estate planning and tax consultation. And so they also saw this as a great opportunity to be more competitive in the market in terms of hiring executives and leveraging this thoughts of financial planning that can be part of a recruitment or even a retention tool. Thirdly, we've also seen a greater sense of urgency to implement our financial wellness solution as soon as possible. Previously, organizations would hold off on implementing until open enrollment. Obviously, however, given the current condition, we're seeing employers finding themselves having to support their employees, in terms of this turbulent, volatile market, and still trying to function efficiently in moving their business. So employers are recognizing the need to manage more immediate needs of their people. So this is really important. And I think it's, how do you balance the issue of demonstrating that you want to support the employees, but also showcasing a level of leadership in these uncertain times? And the key thing that we have always seen, and we can consistently see, even with our financial wellness assessment, is that clients have noted 50% or more of their population are reporting somewhat being very, very stressed about their finances.
Mm-hmm. Yeah, you raise a lot of really good points there, Calvin. I want to go back to something that you said a minute ago around competitiveness. I think that's a really important theme, and certainly I think we bore out in the research we did with employees that employees are looking for this kind of support from employers, and it's not too far of a stretch to say that that's something that they will consider as they consider opportunities. I also think it's in terms of competitiveness among the marketplace. When employers are looking for vendors with whom they can partner, they're going to want to look for certain characteristics, certain capabilities that their partners have. And so I think drawing on this theme around measurement and understanding needs, I'm curious, Calvin, just to stick with you for a minute. One of the important findings of our research was that going beyond this perceived awareness of the employers have, that employers perceive themselves to be aware of the financial health of their workforce, we wanted to understand what they're actually doing. What are sort of the data points that they're looking at? How are they going about understanding their employees' needs? And I'm curious, from your perspective as a solutions provider, what sorts of data points do you find that your clients ask for? What are sort of the KPIs that they're looking for as in their conversations with you, in terms of how do you go about understanding employees' needs?
Yeah, it's funny. You brought up the aspect of KPIs, because what we are seeing, as we're engaging with the employee population, is that more and more organizations, they're recognizing the urgent need to put in resources to delve deeper into the economic impact of what financial wellness is, or the lack thereof. So we at Morgan Stanley, what we're doing, we're seeing that we're the ones that are bringing this information to the forefront. We're showing employers why is it so important that their organization continue to support and invest in this benefit. They're bringing in specifics like where the employees stand and as it relates to their personal financial wellness. So our data, it delivers two sides of the coin. So the first is on the employee experience, and the second really is around the program feedback. So both of these help us enhance our program from an employee experience perspective, as well as getting feedback on the program. So if you think about it, on the employee side, what we're doing is we're bringing our clients a number of different data points gathered through our financial wellness assessment, like financial stress level, the ability of the employee to retire on time. Are they getting the company retirement match? What is their comfort level of investing, and many, many more. What we're seeing is that employers are interested in driving attendees to webinars and interactions the employees are having with the digital portal, but we recognize the need to go beyond that, to showcase true behavior change. Through the data we gathered, our digital portal, to the data that we're gathering through our digital portal usage, also from post-seminar surveys, and even via our high-touch interaction employees are having with financial coaches and financial advisors, we're able to analyze a much deeper holistic picture. We are assessing comfort levels of the employees to manage their finances, their preparedness, what level of preparedness they have in taking action, even to the extent of the actual changes they're implementing in order to enhance their financial lives. From an employer side now, I think this is really the key piece that we're seeing. We're able to provide feedback on how the program is doing. There's a component of investment, and you obviously want to know what's the return on investment. And so we're finding that employers are looking to have a baseline understanding of engagement. And when you think about engagement, again, engagement can be defined in many ways. But at the broadest level, it is a measure of how many participants choose to receive whatever service in which they've been enrolled. But I believe the holy grail of KPIs is being able to measure effectiveness. I think that's what we want to, that's what the survey and the survey sort of brought to the forefront. What is the measurement of effectiveness? And there are various different definitions. So effectiveness, it can be defined as a behavioral change stemming from a service, whether it's educational or solution consumed by participants. But when you further double click into effectiveness and look at the metric through the economic term, there's clearly something that we're seeing. So consider this simple example. As a result of a participant having consumed various retirement-oriented content, they increase their 401 contribution rate from X to X plus, which results in Y dollars of economic savings in the immediate term. And if they hold on to that rate, it results in Y dollars plus during their full lifetime. So we're bringing those key metrics, and we're sort of demonstrating on both sides of the coin, as we would say, how is the employee experience, and then also demonstrating the sort of ROI and the value proposition of what the program is doing from a wellness perspective.
Yeah, that's interesting. So I hear you saying it's almost kind of table stakes to understand what's the engagement with the platform, our employees taking up the service. But the holy grail is really being able to measure behavior change. And I really appreciate the specific example around retirement preparedness and being able to observe changes in someone's actual savings behavior, whether they change their deferral rate or if they've accumulated more savings in their retirement account over time as a result of having engaged with a solution. I want to come back to this point because I think how we measure behavior change is a particularly tricky thing, and I'm sure Ryan will have some perspectives on that as well. But before we dive deeply there, I want to maybe take one step back and go back to the comment you made a minute ago, Ryan, which is just around your sense at Humana that your associates want this kind of support from you all, their employer, from Humana, particularly those that are maybe customer facing. That's one of the reasons why you all see this as a priority, because it ultimately impacts your end customers and the people you care for as a company. So I'm curious how do you know that your employees want this kind of support? What sorts of data points do you look at to understand their demand, their interest, their needs, and specifically what kind of solutions would make most sense for them in terms of the kinds of benefits and support that you can offer as an employer?
That's a really good question, Beth. And I certainly, before I answer that question specifically, I would certainly mirror Calvin's comments and build on them, in saying that education is certainly one thing. I think that we on the employer side are also looking beyond just education. Even advice and guidance is sort of in that middle, but how can we help focus people to take action, and how can we use structures of programs and things like that to help take action, and really easily, even if behavior change might remain elusive, as the sort of the holy grail to get people on the right path. In terms of our associates and how we think about what they want, how they're doing, measure not just financial well-being, but also other aspects of well-being. When we did embark on sort of what we would call our well-being journey about 10 years ago, we realized that it needed to be a cultural change, not just one that you provide sort of lip service, and marketing around that would never work if you're not backing it up with ways that associates feel like it comes alive for them. We took individual data from multiple sources, from our health plan, but also from more traditional HR sources such as organizational structure information, HR programs, including things like 401k, HSAs, financial education pieces, and we took that at individual level, and we go to great lengths to ensure associate privacy. As a healthcare company, we're well versed in that, but we also believe in the data and the power of data to help tell stories, make business cases, drive change, etc. And so we actually created what we call an organization well-being snapshot, and it shows by organization current period metrics measured against goals, change over time, progress that people have made, as well as allowing leaders to compare their organization to others, the enterprise as a whole, but also to other organizations that they've, that may be out there. Oftentimes, if you only measure things at a large enterprise level, and you have a large enterprise, leaders of smaller organizations, and when I say smaller, I mean 100 to 500 people, can often disassociate themselves with the data. You're saying, oh, well, that's the enterprise, but not necessarily, my group. But if they get a document that shares data with them, if they are having data presented that is specifically about their organization and their population of associates that they're responsible for leading, then that really helps increase the ownership of what that data means and what happens to it in the future. This has allowed us to really spread best practices. We've been able to identify areas that are really succeeding in certain areas, help support areas that need additional help, and really built a collaboration with leaders as we consult with them to address focus areas that they and their team want and need. So when they receive, a snapshot of this manner, oftentimes one of the next things, Beth, to your point about how do they know what associates want and need, one of their next things is to have a meeting with some of their top leaders themselves, and then engage all associates and sort of ask them what the group and the team and the individuals want to focus on. Sort of a consensus formed around some of those various metrics that they want to focus on allows the leader to go back and then engage us in HR and say, our team really wants to focus on this aspect of physical health and this aspect of financial well-being, and then we can figure out a way to help support that with tools, programs, et cetera, that can help meet those needs. And so we've found that while the tool itself has evolved over time, that that there's really been throughout the enterprise much more of an ownership over well-being as an enterprise at the individual level, at the leader level, at the corporate function level, all working together and having dialogue and coming to conclusions, as opposed to it being just top down or bottom up. It really goes back and forth and goes both ways.
Thanks, Ryan. I'm seeing a lot of great comments coming in here. I'm really thrilled by the engagement with our audience. So I want to encourage you all to continue to put questions and comments into the Q&A function. I have a comment here from Gayla, says that financial wellness year-round is best. I think we're hearing that already through the comments on the panel, not just at open enrollment time. And Kenyon says that behavior change is the ultimate goal. So I feel like I'm going to want to come back to the theme about behavior change if we have time at the end of the session. But I do want to just pepper in a question here from one of our audience before I go on to some more of the questions that I have. The question is, I think it tees up a little bit off of what you were just saying, Ryan, around your approach at Humana to total well-being and really not seeing financial health and financial well-being as something totally separate, but really understanding it as part of associate well-being. And the question is, what KPIs you're using to measure financial health, and in particular, to what extent are those KPIs connected to other measures of wellness and physical health, and how do you see those two things interacting as you look at your data, and is that something that you try to measure as a data-driven organization?
Yeah, absolutely. I think that we do try to look at financial well-being in a connected manner, and we realize that that's not just for our associates. We realize that's for our members too. We serve members, in Medicaid populations that are facing high degrees of financial, insecurity, and that directly affects their health. We realize as an enterprise that we, need to continue to be on a journey to learn more about some of those connections. That we can't maximize people's health, without also understanding some of those socioeconomic factors, of which a number are financial that impact people's physical health, their emotional health, senses of purpose and belonging, et cetera. And there are interconnected natures with all of that. We worked with an academic institution, several years ago, probably 7-8 years ago, to better design some survey instruments that we felt like did allow us to measure some of those in an interconnected way and build a model. And so that was something that, we did as part of our investment in understanding a more integrated model of well-being. As it is right now, I think that, we still don't have all the answers. I will, sort of tell you that, when we think about financial well-being, that there's really a lot of data that is not necessarily readily accessible to an employer. So any employer out there who is, listening to a call and sort of saying, oh, well, that'd be great if I had access to all this data, but it's not necessarily at my fingertips. Everybody suffers from that. And I think that a lot of times it's outside the sort of the four walls of the employer. People are making decisions about rent, where they live, how they travel, what they're paying for entertainment. Are they, what they're eating, all of those kind of decisions on a daily basis. I would say that one thing that we've tried to do is avoid making assumptions that may be easy to make, but lead to, sort of incorrect conclusions, especially on income. I think employers oftentimes grasp onto income and say, X associate makes $50,000, but we really don't know if that, person is in a household that, has additional income or not. Oftentimes, we may not even know, with certainty about the household size, or, whether or not that person has, assets and other means, not even connected to an income, So there's a lot of challenges, I think, with that, which boils down to the fact that you probably need to ask people, and without asking people, I think that, without finding a way to open the conversation and ask them what their level of financial well-being is, it's going to be really hard to have any confidence in whatever data you can scrape together. Because even if you look at data like 401k data, garnishment data, things of that nature, those may give some indications, but those indications are really the tip of the iceberg.
Mm-hmm. Yeah, absolutely. I think any one data source can only give you a certain window or a certain slice into well-being. It's really the constellation of data sources that an employer could pull together through more of a holistic approach, combining survey data from engagement surveys or wellness surveys, together with some of this benefit utilization data, other metrics that you might be tracking that are important to your organization. I want to transition a little bit to kind of a different theme from our research, which is really around this current moment and COVID, and how we think that all of the events of the last 7 or 8 months have impacted or likely even accelerated the trend toward a wholehearted embrace of financial well-being on behalf of employers. Calvin, I'll start with you. You mentioned this earlier. I think you said that you've seen your clients really hitting the gas pedal, not to put words in your mouth, but maybe have taken a more measured approach over the years to solving challenges and rolling out new solutions. And it sounds as though you've seen some acceleration of that, some quicker action. And I'm curious if you could just give maybe a few examples or share a little bit more about what you've been seeing about how the employers that you work with are responding in this moment.
Yeah, a really good question. The key thing is that we have seen specifically in this time. Yeah, I think it's around a couple things that are sort of bubbling up. Employers, there's a sense of urgency. And I think that's one of the key pieces that we have now realized. And what was surprising, it was around the aspect of employers. It almost goes back to what Ryan was saying. It's the level of awareness was not there. And that was one area that was somewhat surprising to us. Employers are now coming back to us in terms of what are the elements that they can provide support to their employees. And I think to your point around, what we've seen is, one, the level of urgency. That's key. Two, it's even among the immediate short-term support. It's beyond just the long-term. I think historically, there has been a perspective that if I'm an employer and I provide long retirement support to my employees, that should be fine. Now the pandemic had showed up a couple of things. It's what is it you're doing for your employee population and the broad-based population now, and what we're seeing coming through some of the conversations across different industries, across different elements, is what solutions can I support my employees with? And it's an inverse conversation where the employees are the ones raising their hands and saying, I need help. How are you able to help me? How are you able to support in these situations? And even to the extent where the data has most importantly informed us that the pandemic has led to a disproportionate sort of side of a subset of the workers are much more impacted. And, you know, we have seen where we are being called upon to create various financial wellness content that are targeted to a certain segment of the population, whether it's, you know, people of color, whether it's, you know, much in mid-career individuals, and they're looking for that immediate support. This is some of the key things that I would say we're hearing specifically coming from the conversations, and where employers are the ones that are raising their hands because the employees are sort of telling them, I need you to take care of my customized situation. It's not a one-size-fits-all solution, and I need to see how you're demonstrating that with the solutions and guidance they're offering. So those are some of the things that we're building together to support with this new norm, I guess we call it, in this environment.
Yeah, I think that makes a lot of sense. And Brian, I know that resonates with some of the conversations that we've had. I know you all, Calvin's use of the word urgency strikes me as one. I know you all at Humana had some things on your roadmap. Maybe, you know, you accelerated some things that you've been working towards for some time. And you've also just been thinking hard about the needs of specific segments, as Calvin mentioned, in light of this moment. So can you share a little bit about how Humana has responded in light of what we've seen as a result of COVID?
Yeah, absolutely. You know, at first, I think it's important to note that, you know, although Humana hasn't had any sort of restructuring or impacts on our staffing level, you know, immediately when companies were starting to shut down their physical presences in March, we started hearing from associates that they were having household impacts, you know, and so once again, it goes beyond just, you know, the employer data that you may be able to collect. You know, we were hearing that individuals were suffering from household income loss, you know, or job. They were experiencing, you know, upheaval in terms of having to take on additional costs related to childcare, having to, you know, pay more for food even. I mean, as you know, straightforward as that is, you know, people that were sending their kids to school and having subsidized lunches and things of that nature, there wasn't a clean transition to having all of that provided, you know, in a seamless way, you know, in a more socially distanced or at-home environment. And so, you know, we realized that there was a lot of fluctuation, and so we, in many ways, actually took a pause. We had been planning some things for 2021 implementation around benefits. We actually took a pause on some of those things and put them to the side and really focus on how we can provide more stability and flexibility for our associates, you know, in this time period. I think that was back when everybody thought it would be, you know, 8 weeks that we were working at home or something of that nature. And all the companies out there were saying, you know, well, we'll just, you know, until at least May 1st or at least until May 15th. And here we are, you know, almost at Thanksgiving, and you know, we're still sort of operating in this manner, you know, and a lot of companies are operating in this manner. You know, we found ways that we could provide direct financial support to individuals, especially as they were experiencing additional childcare or adult care costs that were potentially going to take them out of the workforce. You know, if they weren't able to afford, you know, solutions to help take care of their children or adults that have, you know, dependents that have needs, then they weren't going to be able to actually show up to work. And so we looked at direct financial support of some of those. We also looked at some of what we consider more critical areas around food insecurity, and we transitioned a program that we have that helps people in sort of times of extreme financial need called Helping Hands. You know, people like natural disasters strike, things like that, and we actually, you know, layered into that some programs around food insecurity and income loss. Ultimately, you know, I think that we've continued to evolve some of those. You know, we realized as things dragged on that we needed to adjust that, and have supported associates as they've had to buy additional technology to send kids back to school in a remote fashion and things of that nature. You know, and those are sort of more financial specifics, but I mean, also time, I think, has been one other thing that, when we talk about impacts on benefits, you know, that's been a major factor this year. Time to make transitions to working at home, time to get, you know, sort of children set up in new arrangements, time to, time set aside maybe of a different time type. If somebody does, is impacted, has to quarantine, or does, come down with COVID and needs to be out of the workforce for some period of time. I think that we've tried to be flexible in all of those. I do think that, when it goes to the sort of the speeding up piece, we had some thoughts around some financial flexibility solutions that were already out there, and they were in sort of a bucket for the future, but we actually, pulled those forward into the present day. And we've implemented an earned wage solution to try to give, earned wage access solution to try to give our associates greater flexibility to when they need to access their pay and some things like that. And so I think that it's been a really interesting year. Certainly not one that anybody could have predicted, but looking back on sort of all the things that have had to change and shift, and I know that I speak for a lot of people on this call, not just Humana, but there's a lot that people have done to help their employees, sort of make it through this year, and that ability to sort of respond quickly and empathetically has been really critical. I think that our associates, when we announced some of these changes of support, and the ways that we're going to be supporting our associates, we got really both sort of just heartfelt outpourings of gratitude, even from people that didn't need, that support, saying that they were so proud to work at a place that does consider those things. It's those things that lead to greater engagement and commitment from a workforce, even for those that aren't necessarily being the direct beneficiary of some of those policies.
I think potentially one of the silver linings of this situation is that employers, more and more employers are looking out at things outside of what maybe traditionally would have been considered an employer's responsibility. So your example, Ryan, of looking at the food insecurity and just understanding that there might be a segment of your workforce that just is struggling to put food on the table, and there's a role that Humana can play through its programming to support them. And then to see the response that you get from your workforce as a result, your associates really are telling you, the same back to you, like, we appreciate that you've seen us as a whole person. I think maybe if there's a mind shift that happens as a result among employers, that could be a silver lining from this period.
And Beth, I think there's some things that are going to change, from this year that, let's say food insecurity. If we know that we've had, couple thousand individuals apply for direct financial support from food insecurity, just going back to a quote unquote normal, once, the virus is not present in as high of levels, doesn't mean that problem necessarily goes away. I don't think we can unsee some of the things that we've seen this year in terms of needs. And so I would fully anticipate that some of the things that we've really been, pushed on this year, that as we do make transitions back to whatever sort of new normals look like, that they continue to be areas of focus and attention.
Yeah, I think you're right. We have some really interesting questions coming in from attendees. This question is for you, Calvin. Joe is asking if there are particular industries in which you've seen employers with a particular interest in helping employees in the short term.
Yeah, it goes back to the first question. The crisis has had a disproportionate impact on various segments of the workforce, and even more so, greater impact on workers in certain industries. So to Joe's question, you think about individuals that work in the healthcare, that's immediate, the frontline workers. We have seen a significant hand raising from companies sort of within that area. Manufacturing, that is hugely impactful because that is a sort of high touch aspect, and almost you have to show up. And this is a very different approach in terms of just how you manage and support during this difficult time. And then lastly, where we've seen the concern sort of raising our urgency is in the retail. I think people across on this webinar can definitely attest. The retail industry has been impacted significantly. I think the number, I don't even think we can quantify a number across it, but that's an area that has been impacted significantly. So those are the three industries that we're seeing that consistently, from a client perspective, are raising their hands or sort of front running to come to really understand what is the solution, what is the financial wellness here what Morgan Stanley can support them with. How do I demonstrate, one, that I am here for my employees at a time of need, while I continue working through business, because individuals have not planned for some of the unique situations that we've seen when it comes to planning for the future, the aspect of, unfortunately, maybe losing a significant individual, or perhaps within the, I had planned to retire in the next 5 years, that shift, that is a significant, or I need short-term support. So we're seeing the concerns really being impacted by workers in those industries, that we talked about, healthcare, manufacturing, and most importantly, retail.
There's another question here. This one's from Peter, and I think I'd like to hear both of your thoughts on this if you have them. Are you seeing companies change their thinking so that when they part ways with an employee, that they continue to provide access to financial health resources for that former employee, maybe beyond just the initial couple of days or weeks, but beyond a month or so that they can navigate the periods they're unemployed, especially during this perilous time? Curious if either of you are seeing that.
I mean, I can jump in and then I'll let Ryan share. We recently, the perfect timing of that question. So we've recently seen where an employer who've actually, to your point, had a subset of employees that unfortunately had to part ways. And, the conversation shifted significantly as it relates to not just how can I continue, but what are the other solutions that you can provide. So, financial coaching, that was one of the major aspects that we had. Now that there's a potential reduction or loss in income, how do we ensure that we provide them the relevant tools for budgeting perspective? Yeah, also from a consultation, or even to the extent of do it yourself, leveraging our access to the digital portal. And to the extent where we're seeing the employers are the ones that are front loading and paying for it. I think that's really sort of a human, or the human aspect of, even though perhaps on the professional front they may not have been the same direction, but how do I continue to support these employees that move on? And that significantly shifts the sort of the formula from our standpoint around, here's the obligation of an employer who wishes to support employees who are no longer part of that active population, but because they've recognized the challenges that have occurred, they're still willing to find solutions to have that continual support as the employee sort of move into a different phase of their life.
Yeah, Kevin, I think it's interesting. Humana is in a position where we are fortunate that we haven't had any large scale impacts of COVID. If anything, as a healthcare company, and we're actually a provider of healthcare services as well, not just an insurance company. We've had a lot of continued demand for our services in taking care of individuals through home health, et cetera, in a lot of the most vulnerable populations, this year, in the Medicare, Medicaid populations. I think that the reality is that, Peter, that's something that is probably evolving. I don't know that, a lot of the programs were set up really to facilitate that. But that's a question that really, sort of makes me think about, what that looks like. It also does go back to some of what we referenced earlier, Calvin, around sort of not just providing education, although that's great, but sort of making it easy and helping people take action. And I think more and more people are, helping employees take the right actions, whether it's having auto enrollment in various programs, whether it's, helping provide good guidance around and making it easy for people to keep retirement funds in a retirement, sort of tax advantage status, as opposed to having people cash it out whenever they're leaving an employer, especially as people's career paths are looking different, and they're at a place for increasingly short periods of time over the course of a career. I think that it's pretty critical that there are continued innovations in how to make those changes really seamless, because compared to sort of an older school model where you work for a company for 10, 20, 30, 40 years and have more stability while you work for them, if you're jumping around and changing employers every few years, over the course of a career and a lifetime and earning, window, that's going to significantly probably impact your ability to build a financially secure, life for yourself, just because of the friction in the system. If financial institutions and companies, employers don't, continue to work to make that easier.
Thank you both. We have a lot more questions than we're obviously going to have time to answer. I want to see if we can get in one more, because I think it's a really good one, and I think both of you are going to have interesting perspectives. And that is from Kenyon, who asks, how are employers removing the stigma about talking about money at work? And maybe if you can combine your answer to that question with the closing question I wanted to end with, which was, just what's one piece of advice you have for an employer who might be just beginning to think about measuring and understanding the needs of their workforce and developing solutions? I think these are kind of two sides of the same coin, because you need to feel comfortable talking to your workforce about their challenges in order to design those solutions. So how do we address stigma, and what's one piece of advice you have? I'll start with you, Ryan, and one with Calvin.
Yeah, I think that they're actually, sort of very closely related. If you were to ask me one piece of advice for an employer, I would say I would encourage companies to have more conversation, around these topics. If we're talking about measurement, then have a conversation on the data. What does it mean? How do we, get the data that we want to look at? What are the implications of the data we have? How does that influence our thinking? And consistency is also really true, whether it's data or the stigma. I think having those conversations and having consistency and showing up and having good intentions, really builds the foundation to remove some of the stigma. It also builds the foundation to, have the conversations with others in a business around, why financial well-being matters and how we can measure it and how we can improve it. So I think those are some of the things that are easy to say and oftentimes, require work and commitment to do, but having, more conversation and being consistent in that conversation and approach.
Thanks, Ryan. Calvin, we'll give you the last word.
Yeah, absolutely. I mean, the only thing I would definitely is, I think the question even more around how do I start this? What do I do? I think that's really a key thing. First, put a plan in place, review it, refine it, make sure that you have the extended team and gain the commitment from the key players within your organization. Second thing, I would say set the expectation for how you want to gather the data. I mean, that is really, to Ryan's point, you have to understand what's happening in terms of what is the concerns that your employees are having. And then lastly, I would say set what will define a success for the movement in that area. Because yes, you can hear it and you want to bring it up, but after you bring that conversation, the expectation is what action are you going to take. So I think absolutely sort of pull all of that together, and then that's really where you'll be able to demonstrate the success of having that conversation with your population.
Thank you. I think that's a great note to end on, and great pieces of advice, a couple of nuggets of advice from each of you. So thank you so much for that. I want to thank all of our attendees for your engagement. I've really enjoyed the conversation and appreciate the really thoughtful questions that you've posed via the chat, and hopefully we got to address some of them. I want to just end by calling your attention to a few upcoming events I encourage you to attend. Our next webinar is focused on financial health in a pandemic, in which we'll be sharing new data from our U.S. Financial Health Pulse Survey, and that's coming up next week on November 17th. And then we have an event in early December focused on the financial lives of young adults and focused on exploring disparities by race and ethnicity. Please join us for both events. You can find out more at emerge.finhealth.network.org. Thank you, Ryan. Thank you, Calvin, both so much for your engagement and sharing your insights in the session. I've really enjoyed the conversation, and I think our attendees have as well.
Thank you very much.
Enjoy the rest of your afternoon, everyone.